Are wireless EMFs fueling the rise in autism, ADHD, gender dysphoria, and school shootings? In the past few decades, our world has undergone radical transformation. Smartphones, Wi-Fi, and countless wireless devices have reshaped how we learn, work, and connect. But as these invisible signals have quietly grown more pervasive, we've also witnessed startling spikes in conditions that affect our children. Autism spectrum disorders, ADHD, gender dysphoria, and yes, even tragic incidents of school violence. The timing isn't just coincidence. These trends align suspiciously well with the rise of ubiquitous microwave radiation in our environment. No one is saying that electromagnetic fields, EMFs, from wireless technologies are the sole cause of these societal shifts. Culture, improved diagnostics, social acceptance, and changes in how we categorize identities and disorders all matter. But we must ask, could EMFs be acting as an environmental cofactor, amplifying underlying vulnerabilities and pushing some children further along paths they might not have traveled otherwise? Aligning timelines when the numbers converge. Autism spectrum disorder, ASD. In the 1970s, autism was rare, estimated around 1 in 10,000 children. Today, the U.S. Centers for Disease Control and Prevention reports a prevalence of about 1 in 36. While improved diagnosis and awareness explain part of this surge, the scale of increase still demands that we consider environmental contributors. ADHD diagnoses have climbed dramatically in recent decades. Again, better recognition plays a role, but some scientists suspect that environmental stressors, chemical pollutants, nutritional deficiencies, and potentially EMF exposure may be nudging more children into hyperactive, inattentive profiles. Recent surveys show a rise in adolescents identifying as transgender or questioning their gender identity. Social acceptance and more open discussions of gender fluidity are key factors. Still, the parallel with other neurodevelopmental shifts is curious. If EMFs affect hormones or bioelectric signals crucial for identity formation, could they be part of this story? Although still rare, school shootings have become more frequent in recent decades. We know multiple factors, access to guns, mental health crises, social isolation, drive these tragedies. But if EMFs can subtly degrade empathy, impulse control, or emotional stability in vulnerable individuals, should we not at least consider them as part of a complex environmental backdrop? So why look at EMFs? Modern science has revealed that non-thermal EMF effects are real. These signals can induce oxidative stress, alter neurotransmitter levels, and disrupt cellular communication. The brain, with its delicate networks and developmental windows, may be especially sensitive. Emerging studies show prenatal exposure can produce ADHD-like behaviors in animal models. Research into electromagnetic pollution is still underfunded, but what we have suggests it's time to look deeper. The urgent need for research. Governments and regulatory bodies like the US FCC or the World Health Organization currently rely on outdated thermal-only models of EMF safety. These models fail to consider non-thermal biological effects that don't heat tissue but still trigger subtle changes at the cellular and molecular level. If we want to understand why these conditions are all rising together, we must invest in independent research that asks the tough questions. Longitudinal studies. We need long-term tracking of children's EMF exposures alongside neurodevelopmental, behavioral, and identity-related outcomes. Mechanistic research. How exactly do EMFs influence bioelectric signals, hormone pathways, and neural circuits tied to attention, empathy, and identity? Comparative epidemiology. Are communities with higher EMF exposures seeing sharper increases in autism, ADHD, or youth violence? Policy integration. If findings validate concerns, updated safety standards must integrate non-thermal effects. Precautionary measures, like encouraging wired connections in schools or lowering EMF exposure in nurseries, could help. A wake-up call for policymakers and the public. A cautious, research-driven approach costs nothing compared to the human toll of ignoring a possible environmental factor in these dramatic shifts. Policymakers, educators, and parents should understand that no single factor causes these complex conditions or social problems. Still, environmental contributors like EMFs could be part of a constellation of influences pushing the needle in troubling directions. Restoring trait fidelity for future generations. If EMFs are adding noise to our developmental environments, distorting traits and increasing instability, then reducing that noise might help. This doesn't mean rolling back technology, it means using it wisely, with informed guidelines that protect developing minds and bodies. By demanding more research, refusing to accept outdated standards, and exploring all angles, we can ensure that future generations inherit a cleaner developmental slate. Whether or not EMFs prove to be a significant factor, asking these questions and conducting rigorous, independent studies is the responsible course of action. Conclusion: from speculation to science. The simultaneous rise in autism, ADHD, gender dysphoria, and youth violence, alongside the soaring presence of microwave emissions, warrants examination. Correlation doesn't equal causation, but ignoring possible links because they're inconvenient is reckless. We must move from speculation to science. By embracing a more precautionary stance and investing in the necessary research, we can either lay these concerns to rest or uncover actionable paths to improve public health. The stakes are high. Our children's futures, their cognitive and emotional well-being, and the stability of our communities depend on honest inquiry and informed policy. If EMFs are part of the puzzle behind these troubling trends, we owe it to ourselves, and especially to our children, to find out.